Hi, I'm Dr. Moss, and I'm here to help you find your balance again with our new in-home balance program. By the end of the program, you're going to be able to confidently improve your balance and stability with simple and effective exercises that you can do safely at home. I've combined my 27 years of experience with the wonderful World Wide Web, video technology, and some PDF instructions to help guide you through this program. So what exactly is the program, and why would you even want to look into purchasing the program? Well, I'll tell you. So first of all, it gives you very simple, easy to follow instructions on exercise that you can do at the house. It also gives you an assessment that you can do, and that assessment is essential because that's what we do in the physical therapy clinic. Is we want to test you first to get a baseline. Then as we take you through these therapeutic exercises and these balance programs, then we can come back and retest to measure that improvement. And so I'm giving you that same option at the house. You'll take these assessments, figure out which program. We have 3 different programs based off of if you fail all these tests and you haven't exercised in quite a while, or you do pretty decent on the test and you can go for the little bit more progressive nature of the programs. So we have 3 different options for you. The other is the exercises are very easy to use. Again, especially if you're starting out with our first program, Program A, it's very easy, it's very gentle on the joints, and it's really some of the key exercises that we do with our clients here in the clinic. Like I said, there's 3 different programs. Each program gets a little progressively harder. We recommend that you go through one program for about 30 days, come back and reassess yourself, and then see if you're able to move on then to the next program based off the scores on your assessment test. So are you ready to feel steadier and more confident? So what if you could move with greater ease, without fear of losing your balance, greater strength, and greater stability? So in this program, that's what we're going to help teach you. We're going to teach you how to assess yourself and then how to follow along with these specific strengthening and balance exercises to help you improve your overall stability, your strength, and your confidence, all from the comfort of your home. Okay, you'll receive a comprehensive PDF. It's over 40 pages long, talking about the ways to go through the assessment, how to score yourself, what is normal, what is not normal for male, female, and different age brackets. That's same data that we use here in the clinic to help design our programs. There are also a series of videos that will help you walk through the assessment and all of the exercises so you can see how to perform those exercises just in case the PDF isn't fully clear to you. Some people are more visual learners. That's where they like the video. Other people like to read and then practice. So we have both forms for you. And of course, we're here to help guide you along the way. So why would you even consider this, and why is it potentially beneficial for you? Well, one is if you are falling at home or you're feeling very unstable, you're scared it's going to continue to get worse. However, you're not really sure what to do. This is a great option for you, especially if you don't want to leave the comfort of your home, or you're kind of worried about coming into a larger physical therapy facility. You know, you don't want to be around people. Maybe you're a little bit shy. You're kind of embarrassed, right? We have people that they come in and they feel embarrassed that they're in therapy. But guess what? You're in here with a community of people, and they all have some type of problem. And that's our mission. Our mission is to help you with your problem and meet you where you are. And so if you're not comfortable coming in to a physical therapy program, maybe you're not driving, you're having difficulty with transportation, I think this is a great option for you. The other thing that we see, and we've heard from a lot of people, is maybe you've done physical therapy, you finished, and the therapist has given you a home program, but maybe you feel like you're at a point where those exercises are too easy, or you've stopped doing them and you're really not sure where to pick up. This is a great option for you as well. Again, as I mentioned, difficulty leaving your home, transportation issues. You don't want to bother your friends or your family or your neighbor. I get it. So please, this is a fantastic option for you. And we also have a, what I say is a what the heck effect. Okay. And so when you start exercising, and if you haven't exercised in a while, there's usually some other benefits that come along with it. And when you start practicing balance and strengthening exercise, especially for the lower extremities, most of the time you'll start to notice, hey, it's easier to get in and out of the car. I can get in and out of my chairs a little bit easier. I can move through the house without kind of furniture surfing. Those are some of the common things that we'll hear from our patients that are going through this in-home balance program. So don't be surprised if you start to have some what the heck effects as you start to practice these balance and strengthening type exercises. So What do you get for your investment? Let me tell you, we have developed a very comprehensive, over a 40-page PDF, color photos, large print, goes through the assessment portion, it goes through the exercises, and it lays out all the exercises that you'll need to do. The exercises are simple yet very effective, and we've designed the program should take you maybe 15 minutes, maybe 10 to 15 minutes a couple times a week to do these exercises, yet the benefits are going to be exponential. There's videos describing the assessment. How do you test yourself? The scoring is there in the PDF. So you'll do the assessment, you can record your scores, and then you look at the PDF and it tells you if you're male or female. You look at your age categories and tell you, am I within this normal range or am I failing these? Okay. And if you're failing multiple assessments, that tells us that you're at a very high risk for balance and falls. And we know that people over 65 years of age, 1 in 4 over 65 is going to have a fall sometime this year. And a lot of those will end up with injuries and in the emergency room. And we don't want that to be you. We also have developed from the feedback a one-page quick start guide. The quick start guide tells you, gives you the website where to log in, go through the assessment process, and then how to pick the appropriate program to go through. And then again, very simple yet effective exercises that anybody can do from the comfort of their home, safely in the comfort of their home, and they should start to see some very rapid improvements. So I hope you will join us along the journey to improving your balance with our in-home balance program. And if you have any questions, please leave comments below, send us an email, reach out to us. We would love to hear from you. Thank you, and God bless.